I'm Niall Quayle and I'm a Senior Lecturer of Nursing at Keeldarry, which is the School of Health for Manx Care. So I started my nurse training in 2010. I think I was the second year of the degree for nursing. So nursing has fairly recently become a degree level qualification. So that was implemented in the Isle of Man in 2009, I think. So I was the second year. So I did my 3 years here, felt really well supported, really enjoyed my time doing my nurse training. And then in 2013, I qualified as a nurse and worked in Nobles Hospital for a couple of years. In 2015, I got a job as a community nurse, working around the Isle of Man, caring for people in their own communities, in their own homes mainly. And an opportunity came up in, I think it was 2019, to apply for a role here. Teaching, it was always something I fancied doing, and I was lucky enough to be successful in that application, and I've worked here ever since and really enjoyed it. Felt really valued and challenged, and really enjoy seeing people starting as student nurses and going through the 3 years of the nurse training, and then going into like amazing careers as nurses on the island and afar, really. Yeah, so I feel really lucky to be able to have this job. I think I would recommend nursing to the right kind of people. So people who have that caring kind of personality and characteristic. That's really the first thing I would look at before I was recommending nursing to anyone. People who want to get into nursing, they would like a challenge, like team working, kind of to be put out of your comfort zone at times, basically for people who are really passionate about helping people and are good communicators, good team workers, and mainly just really caring. Yeah, so I would recommend it to those kind of people. Nursing is sometimes seen as a kind of undervalued profession. The days of doctor says, nurse does are sort of gone now. It's a professional qualification in its own right that has autonomy, and there's lots of nurse leaders now within the profession. So, for example, nurses lead complete services, and a lot of nurses prescribe and diagnose and have a lot more extended roles than perhaps maybe it was in the past. I think something like Nurses' Day doesn't recognise the importance of nursing. I think most people have either been cared for by a nurse or had a family member cared for by a nurse, and usually they remember those people because they're caring and they're kind and they're compassionate, and they make an experience that might not be very good at all, where you have to go into hospital or require care from professionals. It's often the nurses that make that as comfortable as possible. Nurses' Day just highlights the valuable role that nurses have in our community.